In the United States, healthcare is a very complicated choice, and two barriers to effective enrollment are low health insurance literacy and lack of knowledge on how to choose a plan. To help address this issue, companies have created a new digital decision aid called a Virtual Benefits Counselor, or VBC, which mimics a one-on-one interaction with an HR benefits counselor and guides the user through the process of choosing health insurance and makes personalized recommendations. Little research exists on the efficacy of these new decision aids, so this study aims to compare user enrollment decisions using the guided VBC against a self-guided HR website. HR websites are a traditional source of information for consumers, and consumers have control over what information they see or consider. Our hypothesis is that the VBC participants will be more confident in their enrollment decision, find the system more usable, and show a greater increase in health insurance literacy and knowledge. In this experiment, participants were asked to make a hypothetical enrollment decision using one of these decision aids. During this process, eye tracking data was collected and used to support a retrospective Think Aloud session at the end of the experiment. A health insurance literacy measure and knowledge test were administered before and after the experiment, and additionally, after the experiment, we measured user confidence in their decision and how usable participants found the system. What we found was that any changes in the health insurance literacy and knowledge test scores were not dependent on the system used, although the knowledge test scores did increase with the post-test. The only measure of health insurance literacy that increased by the post-experiment was confidence in using health insurance. Descriptively, it appears that the website users were more confident in their enrollment choice. We also found that VBC users found their system more usable. We predicted that VBC users would be more confident in their decision and show more increase in health insurance literacy and knowledge, but this was not the case. One possible explanation is that the guided nature of the VBC meant that participants were limited in their ability to explore and find information that they were interested in using. The feedback from the Think Aloud interviews suggests that participants did not always understand why the VBC made certain recommendations. Participants often accepted the plan without looking deeper into the details, which may have led to decision conflict and lower gains in literacy and knowledge. In contrast, participants in the website condition needed to make their own decisions, which may have led to confirmation bias guiding their information-seeking strategies in a manner that resulted in less conflict. Overall, we found that interaction with sources of health insurance information and decision support can benefit informed decision-making, but more research needs to be done to understand the differences between the guided VBC and the website.